So who do we have with us today?
I am Randy.
Hey Randy, so what type of problem brought you to my office?
My left knee, underneath my left knee, was very painful. It was very hard to walk. I couldn't bend over, couldn't put my left sock on. It was just uncomfortable. My job entails walking, and it was difficult.
So like the type of work that you do, how many miles or how long would you walk a day, do you think?
Probably 5 or 6 miles.
Wow.
Up and down hills. It's not even.
So you have to have good joint function in order to feel comfortable out there.
Absolutely.
So how long did you have this type of problem?
Since April of 2020.
April of 2020. So this is August 2021, so that's quite a bit of time.
Yes.
And then what types of things did you try and do before coming here to get help?
I had 4 cortisone shots and 1 gel injection about every 3 months.
And did you find it helpful at all?
Temporary.
So it would last for how long?
Maybe a month or 6 weeks.
Okay. And the challenge is they can't usually do more than 3 or 4 shots because now the cortisone will make your ligaments weak. So that's why they limit it, and they say, yeah, now your next step is, what were they saying?
Well, they talked knee replacement right from the beginning, but they never told me that I could have X amount of cortisone shots.
Oh, okay.
They never told me that.
Yeah,
So,
it even makes your bones weak.
Well.
So, well, now you know.
Not good.
Yeah, so then how did you end up finding us?
My wife's daughter had come to you and had some PEMF for her foot.
Oh, okay, very good. So she recommended, we did an exam, we found out that you had quite a bit of restriction in several joints, and muscles were short.
Yes.
So we ended up using a combination of chiropractic care for the extremities, for your spine, and then Trigenics and PEMF. Did I miss anything?
No, those are the 3.
Okay. And then how did you find the treatments in terms of how they felt?
Well, I think actually the treatment's feeling.
Yeah, like
as they're being done or after. Well, while they're being done, of course, there's a little bit of discomfort, but that's not a problem. It wasn't a problem from the beginning, and it isn't now. And
then how are you feeling today?
I feel a whole lot better.
So do you have knee pain at all, or?
It's very minor.
So just a nuisance.
It's just a nuisance. It's nothing even close to what it was.
But you can now put your left ankle on your right knee and put your sock on?
Yes, I can.
That was a big goal.
That was a very big goal.
Yeah. And then how long did it take, do you think, to get to the point where you could feel a difference? How long into care?
I started the first part of July, I think July 8th, and by the third week of July, I was doing pretty well.
Awesome. So that didn't take too long.
No.
And so what are your thoughts to other folks that are maybe having knee problems in terms of what if they've been told, hey, the only thing you can do is have surgery or physical therapy?
No, you've taught me so many things. I thought it was a bone problem or a joint problem or something, which, but you've taught me so many things about my body in terms of the muscles. I didn't know I had short muscles and how much it pertains to knee problems and that. So I've learned so much other than just helping me.
So you had the hip on that same side was very tight, right? We worked on that.
Yeah, I had X-rays done.
And we found out, there's some issues there. One of the interesting side benefits was when you first came here, because of the work you do, you look down a lot at what you're doing.
Yes.
And your head was kind of forward of your shoulders quite a bit.
Yes.
And when you would lay on your back, your head, you couldn't lay down flat.
No. I couldn't. I had to have 2 or 3 pillows raised up so I was comfortable.
Yeah, and so now when you lay down, you can actually lay flat with just a little bit of your head tilted up.
Oh,
and
that's right.
Did you ever think that could be done?
No.
I was actually pretty pleasantly surprised.
It really bothered me laying. I couldn't lay on my back. I do my exercises that you recommend with the with the molding. That I do. I try and do it every night, and it really, I can do it. Last time I almost went to sleep.
Awesome.
So I get comfortable,
Yep.
and I lay flat, and my wife remarks about how my head looks so much better.
Good, good. So, well, we're really happy that we were able to help. I mean, that's really why I'm here. My passion is to help people have a healthier life and be able to enjoy their years. So we always say chiropractic adds years to life and life to years. And when we add the other procedures in, it's like most of the people, as long as we feel like there can be a good candidate for what we do, we can usually help them. For people that we don't feel is a good candidate, we don't accept them for care. So that's why people say, how come you get such good results? Is because we have a criteria for whether we can help someone or not. And that's the main reason. So.
Well, you identified me correctly.
Yeah.
There's no doubt about that, because there's total difference between the end of June compared to 6-8 weeks later.
Awesome. Well, thank you so much for taking the time to share your experiences with folks that will see this.
Very good. You're welcome.